Chapter 2, about choking treatment, starting with adult cardiopulmonary resuscitation, CPR. Part 25, Adult Cardiopulmonary Resuscitation, CPR. Welcome to the lesson on Adult Cardiopulmonary Resuscitation, CPR. In this video, we will discuss through the steps of Adult Cardiopulmonary Resuscitation, CPR. What is cardiopulmonary resuscitation, CPR? Cardiopulmonary resuscitation, CPR, is comprised of chest compressions, airway management and rescue breathing to deliver high-quality cardiopulmonary resuscitation, CPR. Begin with high-quality chest compressions. Compressing the chest circulates blood to brain and heart. Chest compressions should be delivered at a rate between 100 to 120 beats per minute and depth of 2 to 2.4 inches, that is, 5 to 6 centimeters. How to provide cardiopulmonary resuscitation, CPR, to any adult? Step 1. Ensure safety of the sense and area around the individual is safe. Step 2. Tap them if they are okay and ask loudly, "Are you okay?" Step 3. Yell for help. Use a cell phone to call 999/EMS and send a bystander to get an AED. Step 4. Check the individual's breathing. Step 5. If the individual is not responding, breathing, or only gasping, start cardiopulmonary resuscitation, CPR. Step 6. Give 30 compressions at a rate of 100 to 120 beats per minute and at a depth between 2 to 2.4 inches, that is, 5 to 6 centimeters. Let the chest rise back up before the next compression. Open the airway to give 2 breaths. This concludes our lesson on cardiopulmonary resuscitation, CPR. Next we will review compressions.